Does photodynamic therapy lead to skin necrosis? Imagine a treatment that targets skin cells with precision, helping clear up precancerous spots or superficial skin cancers. That's what photodynamic therapy does. It uses a special drug called a photosensitizer applied to the skin, which is then activated by a specific light wavelength. This process causes a controlled reaction that destroys abnormal cells while sparing most healthy tissue. Now, while photodynamic therapy is generally safe and effective, it can sometimes cause skin necrosis. Skin necrosis means the death of skin tissue, which can happen if the treatment parameters are too intense. But it's important to know that necrosis is a rare side effect and usually occurs only when the treatment is not carefully controlled. Factors like the dose of the photosensitizer, the amount of light used, and the timing of the light exposure all play a role in the risk. Most common side effects of photodynamic therapy include redness, swelling, pain, peeling, and crusting. Sometimes blistering or ulceration can occur, especially if the skin reacts strongly. These reactions are usually superficial and tend to heal on their own without leaving scars. Full-thickness skin necrosis is uncommon and typically linked to higher doses or more intense light exposure, especially in areas with significant sun damage or precancerous changes. Research shows that the risk of necrosis depends more on how the treatment is administered than on the drug itself. Proper control of the drug dose and light exposure helps prevent excessive tissue damage. Clinicians carefully adjust these parameters based on the patient's skin condition and the area being treated. When done correctly, the chances of developing skin necrosis are very low. In summary, while skin necrosis can happen after photodynamic therapy, it is a rare event. Most skin reactions are temporary and include redness, swelling, and peeling, which usually resolve without lasting damage. Patients should be monitored closely during treatment, and any severe or unusual skin reactions should be checked by healthcare professionals promptly. This understanding highlights that photodynamic therapy remains a safe, minimally invasive option for treating certain skin conditions when performed under proper medical supervision. It's always best to discuss your individual case with a qualified healthcare provider to ensure the safest and most effective approach.